I'm Rodrigo Onofre, the co-instructor of the crop disease course with Judy Omero, and today I'm here with Eric, Adee. Eric, tell us a little bit about yourself.
Okay, I'm Eric Adee. I manage this research farm in the Kansas River Valley Experiment Field. We have this field here at Rossfield and then one over by Topeka. And I'm a plant pathologist by training, but actually I grew up on a farm in north central Kansas near Minneapolis. So I went reluctantly back to school and became a plant pathologist, but now I get paid to farm and also do research on trying to answer farmers' questions.
And talk about answer farmers' questions. What's going on in this field that we are here?
Okay, we're standing in part of a Kansas soybean performance trial. It's actually a variety trial. Companies pay to enter different varieties and we see how they do in yield wise. And we have sudden death syndrome showing up in this field. This river valley has a history of getting sudden death syndrome, especially in the irrigated fields. And first it'll start up with very faint symptoms. You can't hardly see anything, just light green, very just showing up in the uppermost leaves. But eventually you will start seeing this interveinal chlorosis, which is the yellowing, and then necrosis, which is a death between the leaves. And this is because the fungus, which is infected early in the growth season, is now sending toxins up the vascular system and it's accumulating in the leaves. It's kind of like a dead-end street. The toxins all go up there and they all end up between these interveinal areas of the leaf, and they get enough toxins there, it starts killing the leaves.
And Eric, when do you start or usually start seeing the symptoms in the field?
Generally around the 1st of August is normally when we start seeing them. About R3 soybeans are just getting pods formed about an inch long. Some years I've seen it earlier, and if it's earlier, it's going to be much more severe. You're going to have much more yield loss. If it shows up later and the beans have started to fail some, the yield loss may not be as much, but it can be very severe.
How much do you think this disease could affect the yield of a field?
We have seen over 50% in some years. Typically, like this field will probably be 20 or 30 bushels off of a field that wouldn't have under similar growing conditions without SDS. So we're losing at least 30% of the yield.
And do you usually see this disease like has a pattern across Kansas, or?
It's kind of isolated areas. Right here in this river valley is one of the hot spots. Now we get up up in the hill fields or in dryland fields just a half mile away or a mile away from here, we don't see it because we don't have the ideal conditions for it historically. Northeast Kansas has some SDS and south central Kansas has some areas where they have SDS, but either they're on very productive heavy soils or they're in irrigated soils that have a history of irrigation.
So water could be a problem for this disease?
It seems to be favored by water. When I was in Illinois, we knew if we had heavy rains with water setting in fields around the initiation of bloom, right at the end of June, we would start seeing SDS in August in those areas. And we know there's a water association here as well. Just in this down here, we just get it every year. And sometimes farmers have blamed it's related to irrigation. I have seen it where we've not irrigated a field historically and it stopped. There's no SDS there. So water at the wrong time is necessary for this disease to infect and really take off.
And after seeing the symptom, is there anything that growers could do?
This variety trial is one thing they can do. I'm taking ratings out of them, and if a farmer can select the best variety that has tolerance to SDS, we don't really have resistance to SDS. We look for the best tolerance we can get. And then also associated with that tolerance to SDS, it's been shown that if varieties have resistance to cyst nematode, they do better in the presence of in fields with SDS. And the additional things, so variety selection is the first thing I would do, and then seed treatment. Just a few years ago, we had done some research here for companies, and we found treatment was very effective. It was increasing yields 15-20 bushel an acre, and it's Allevo is the name of it. It's very effective. It also works against cyst nematode as well. It has some activity against cyst nematode. Last year, Syngenta came out with another seed treatment called Saltro, and so in combination of variety, picking the most tolerant cyst SDS tolerant variety and a cyst nematode resistant variety, and then using a good seed treatment in an area, in a field where you've had a history of sudden death syndrome. That's the best management you can do.
So if you do crop rotation, because we're talking here about like it's a soil-borne pathogen, right?
Right.
Will survive in the soil. What have you seen?
Crop rotation doesn't work on this, partially because this fungus survives as a saprophyte in the soil, breaking down old crop residue. And they've also found it survives in corn residue or corn seed that's left after harvest. So normally in this river valley we're rotating corn and soybeans. Well, that's not helping because this fungus is surviving as a saprophyte for quite a while on old residue. But under certain conditions, microclimate conditions in the soil, it's able to infect soybean roots.
Wow, Eric, thank you very much for all your sharing your expertise with us. I'm sure the students and Judy will be very grateful for your participation in the class.
You're welcome.
Thank you.